All right, everybody. Now that you've had a few lectures on the gas exchange and the mechanics of breathing, let's take a moment and go over a brief clinical correlation, arterial blood gases. And this is something you're going to go over a little bit more in your small groups that you'll see later. An arterial blood gas is something that we can order as physicians, and usually it's drawn by a respiratory therapist, or we can draw them ourselves. And what you're seeing here is the therapist using a needle to puncture the radial artery and obtain blood directly from the artery, as opposed to a vein, which is where we normally draw most of our blood samples from. And the benefit to this is that you can directly sample, like I mentioned, the arterial blood, and what we get is some information that's very clinically relevant, and we've sort of touched upon in class, but I'm not sure if we've really shown it in this format. So typically, and this is just a sampling of what some of the information that we can get, but the most important pieces of information are the pH, the arterial partial pressure of carbon dioxide, the P little a CO2, the partial pressure of oxygen, the P little a O2, the serum bicarbonate level, which is, and if you recall, bicarbonate is the main buffer for acid in the blood, and then the percent saturation of hemoglobin. And this is typically recorded or reported, in this fashion with the pH, PCO2, and PO2. And then sometimes people will also throw in the bicarbonate and the saturation, but you'll hear people on rounds, in the hospital say 740, 40, and 100, and because of this convention. And what I'm showing you here are the normal values, and it's a range. So 7.4, you could say the range is 735 to 745. The PaCO2, or just PCO2 for short, is 35 to 45. The PO2, typically 80 to 100. The bicarbonate is about 22 to 26, and then the saturation should be above about 95%. And so what happens, when we use this clinically is when we have our friend who's been smoking for about 100 years, Mr. Smith, who comes in, and of course he's wheezing up a storm, and he says to you, "Doc, I can't breathe," and he needs your help. And so this is a time where we might order an ABG because we want to see what's going on with the respiratory system. And so now what I'm showing you here is typical of what you might get back when you order that ABG. And again, here are the normal values down in white at the bottom. So we have a pH of 7.24, meaning he's acidotic. PaCO2 of 60, which is elevated, as you can see. The PaO2 of 60 as well, which is low. The bicarbonate still sitting at 24. And the percent saturation of hemoglobin of 90%. And so what you can see is that his emphysema is causing him to hypoventilate. And we know that because his PaCO2, P little a CO2, is high. And that's being manifested clinically by a low pH, because the P little a CO2, as it rises, produces acid, produces hydrogen ions. The second thing that you can see is that he's also hypoxemic. So remember, hypoxemia means that the PaO2, the partial pressure of oxygen in the blood, is low. And he's also has a low oxygen saturation. And then what the bicarbonate shows us here is that his body hasn't really compensated for this problem. So the bicarbonate, again, is that major buffer, and that's typically, as Dr. Schulman touched on a little bit in class today, regulated by the kidneys. But this is a very slow process. As you can imagine, the respiratory system can respond minute to minute, whereas the kidneys themselves take time. Let me get right back to that there. So what we're seeing here is that this is an acute process, that this has happened all of a sudden, and the reason that this patient is hypoventilating is because his airways are obstructed or closing off, and he literally can't get all the air out before he has to take another deep breath in. And if you can imagine from the pulmonary function tests that you saw today, you would see that his flow volume curve would look very scooped out, almost like an L. And he could blow out for 10 seconds or more before having to breathe in, and all that air would still be trapped in there. So this is just a small introduction to ABGs, and I hope that it helps.